Hello. So we're live just in time. Give it a couple of minutes. Hello, we have 2 viewers. Okay, so I'm going to give it a couple of minutes and have too long. Okay. So I'll get started. So this live is going to be about what we call proprioception, which is a fancy name for joint position sense. So how well your body's joints can understand where they are in space and time, and understand where they are in conjunction with the rest of the body. So with joint position sense, that's sort of the definition of proprioception. But proprioception as a whole falls under a larger category, which you could call as the sixth sense. So it's an umbrella term, which is called somatosensation. So that's a term for how you can understand and feel vibrations, pressure, touch, temperature, pain, balance, and finally proprioception, which is joint position sense. So that's the category that proprioception falls into. How it works is, out of these receptors in the body, it starts in the nervous system around your limbs and feeds back into the central nervous system around the spinal cord, and then back into the brain for you to better process what's going on with that joint. So there are submodalities within proprioception. So there's passive joint position sense, which means the positioning of a joint under assistance. So you're not physically moving it yourself. Either the other arm is moving it towards it, for example, or someone else is doing it for you, or actively where you are doing that joint position. Within that, there's motion sense itself. So not just the position of movement, but the speed, duration, direction, acceleration of that movement. That's something that you can also quite well understand subconsciously, Also, you're able to understand when you move a joint, the effort by which you're moving that joint. So how much heaviness there is in the motion, the tension of the force within that, and also the velocity, so the speed. You have an ability within each joint to detect vibrations and convert that to speed. Just if you can imagine a train along a train track, sometimes you, just by the vibrations of it, you can work out just how fast that train's going, and that's the same thing as that sixth sense that you can feel throughout your body. So we'll dive into the sort of the neurology, so how the nerves work within that. You have two sort of receptors, so they receive signals, There's mechanoreceptors, and the proprioceptors, joint position receptors, both of which are located in the skin, the joints, and the muscles. If you imagine these receptors, so when they receive information, it's a continuous loop of feed forward and feedback inputs throughout the body. So the receptor receives a signal and it sends out a signal. And just that's how we are able for our bodies to understand where they are in space and time. There's multiple names for these receptors within the muscles. They have specific names, and they are also found in the ligaments as well. But they can have, they are put into different subtypes and subcategories. They go from very small to large, and they have different speeds. So they will kick in. Some receptors will kick in where there's a slow movement compared to a fast one, and another will kick in when you're doing a fast movement compared to a slow. So the smaller ones have quite a higher threshold in order to activate. So it takes takes a larger stimulus for them to be reacted. Just like, for example, if you were to lift a heavier weight, for example, those higher threshold receptors are going to be activated more than a smaller one, such as just a small movement of the arm, or let's just say the pinky toe, for a better example. So we've discussed sort of how it works biologically, these receptors in the body, but they can also, what we need to understand and what you need to understand is how this can be changed. How can you lose that sense of being able to balance the joint and being able to understand what you're feeling around that? And there's a number of causes. One of those is intoxication. So, as I say, you drank too much on the weekend, then what happens is those receptors get impaired and you lose that sense. That's why people can fall over, let's say on a night out. That's one example. Secondly, there's age. So as you get older, the risk of loss increases of these receptors. And there's changes within the tissues and the joints that have these receptors as you get older. Let's say arthritis, for example, is more likely when you get older. And the tissues change and then the receptors get lost within that. So age is another cause of impairment. Finally, there's a large number of injuries and medical conditions that affect this proprioception. The most common ones and the ones that you think about the most are injuries and medical conditions that affect the neurological system. So we're talking Parkinson's or ALS. If you have a slipped disc, for example, slipped disc, it's supposed to be, we're not supposed to call it that. It's a disc herniation, so it's a disc bulge. Arthritis, I mentioned before. Neuropathy, which is basically damage to nerves. And also, finally, after surgery, you can lose this proprioception. If you think about as well, just in broad context of injuries in general, not just with surgery, there's large structural changes and inflammation, so swelling. And that swelling can then interrupt the signals of those receptors that I mentioned earlier. For example, if you were to have a dislocation of the shoulder, and if we stick into just the upper body, with that dislocation, there comes a lot of swelling and that feeling of a loss of control, and that's where these receptors are affected by that. If if you think of it as a way of a signal. So these receptors work on signaling, so they require a stimulus in order to act and react accordingly. So once you get that swelling and dislocation, that blocks the signaling. So if you do get a dislocation of the shoulder, then you are unable to move the joint as controlled as you did previously. Another another inflammatory issue with the shoulder is frozen shoulder, which I'm sure some of you or most of you might have heard, which is that where that capsule gets really locked and you are unable to move it as freely. The receptors that allow for the positioning of that shoulder and that understanding of where it is in space and time, those get blocked as well. So if you are starting to have these feelings of a lack of control, what you will tend to notice is a lot of balance issues that come with that. So frequent feelings of being unable to prop yourself up out of bed, or that feeling of if you're holding something or holding on to something that is going to give way at any point, that's sort of like a balance issue. And what can also come with that is uncoordinated movement. So you're unable to reach for an object that's in front of you without sort of missing it or reaching too far past it. You can't understand that connection that you've lost has been a detriment to how you are normally. So on top of that, you can also get that avoidance of trying to that fear of trying to move it. Once you realize that you've lost it, you're then thinking you have that fear avoidance, so you want to avoid that activity, which then makes it even worse. And these are a lot of things that we are going to pick up as therapists. So if we notice there's that apprehension, that could be a clear indication that you have lost that proprioception. Speaking of our assessment, we can also look at someone's overall coordination through a lot of testing. You may have heard of the finger to nose test, whether you can follow someone's hands and follow them repeatedly. If you are unable to do that with the upper body, then that's something that we would see as an issue with proprioception. In your day-to-day, you might see some increased clumsiness, poor control of your posture, so you're really a lot more slouched as a result of this loss of position sense. So if you can't understand why you're in a poor posture position, maybe that may be a result of an issue within the joints that are stopping you from being in a more slouched position. On top of that, you might be noticing you're unable to apply as much force as you used to in the arms and the shoulder. For example, the elbow. If you have what we call a bursitis, so like a swelling in the elbow, you can lose that force, and that's another indication that you're also going to lose that position sense. So what can you do to get this better? So upper limb, which I'm going to focus on for this week, is not as understood and as practiced as the lower limb. By the limb, I mean the upper body. So when you lose that position, we're thinking torso, arms, shoulders, the elbow as well. So what we want to do is you need to get that re-education of, as I've mentioned in the entire first section of this, of understanding why it is that you've lost this, and sort of backwards diagnose from there. So you may have some lack of understanding, but after this you should understand, okay, the reason why I'm feeling like this is because I've lost that receptor. One key principle of what you can do to get this better are frequent, consistent and repetitive exercise. It's very key that you repeat, because there's a whole process that's involved with you losing your joint position sense. There's detection, so realizing that you have that problem, trying to localize that area and discriminating between different stimuluses or objects, and there's a lot of things to do and work on that you can lose. So therefore it requires a lot of practice, and the only way that you can get this better is by repeat, and that's why it's so important that we push forward consistency in exercise. From there, you're thinking about balance now. So you want to improve balance training on both normal surfaces and then unstable and unpredictable surfaces to better progress you in those exercises. One thing that's really good and shown in the research is dual task training, which means using both sides. So for example, I might have hurt my left shoulder, but you can also train this left shoulder inadvertently by repeating action in the one that's working, because the way that your brain and the limb is connected and wired, there is also about a 10% of what you learn on one side can get translated to the other without actually having to move it. So this research is also based on stroke patients. So they've been found that doing this sort of exercise on both sides can better help with being able to get that feeling and get that strength, etc., back in stroke patients that they've lost. So I can go through a few examples of exercises that you can do. I've already mentioned the finger to nose, but there are a few things that you can do with the shoulder specifically, which is mainly going to be the issue with upper body is the shoulder. Occasionally the elbow with that swelling that you can get around it, of course. But these exercises are mainly focused on the shoulder. You can if you have a stability ball, you can place it against the wall and apply and practice circles with that, both with open eyes and then closed eyes, because once you close your eyes, you're removing a stimulus, and if you remove a stimulus, you make it more difficult. So that's a progression level that you can add to any and all exercise that you do with balance and proprioception. On top of that, I don't know if you've seen in the gym, these Bosu balls, which are basically like a rounded, soft ball that's quite uneven and it's difficult for you to stabilize on. If you perform upper limb tasks such as push-ups or shoulder presses, that sort of thing, with that ball against your hand, you then get a better joint position sense. On top of that, you want to do focus on a lot of exercises with not just in a closed chain, so not against something with your hand, but in the free. So that would mean bouncing a ball and catching it, so you can better judge where that ball is going to land and get a better judge of joint position sense, as well as what we call clocks. So you're going to follow the clock, the hands of a clock, and see whether you can get very close to, or if not dead on, and try and improve from that onwards. Okay, so that's giving you a good idea of what proprioception position sense is. And if there are any questions, drop it in the comments and I'll try and get back to you. But that should give you a better understanding of if you have got an injury or any of the conditions that I mentioned earlier, why you're starting to feel this lack of control. and what you can do about it. Okay? Thanks a lot for coming, and I will end the video now. Take care.